And when it comes to radiology, like there are so many side effects that the patient has to.
Yes, for radiation therapy there are, but everything is, because what happens is cancers are ultimately cells. Whatever treatment you're giving, except surgery, is directed towards stopping the growth of those cells in your body, the skin, the hair, the lining of your gut, the stomach, and everything. They also keep getting removed and build up new. So the radiation and the chemotherapy target them also. Everyone is trying, the entire research is going on to make it more specific. Earlier there were agents we used to cause more side effects. Now we have agents which cause less, but still it's a continued development. It's an evolving field. That's why you have loss of hair, the skin rashes, the diarrhea, the vomiting, but those are inevitable. Some will have it more than other. People are given injections. We give them drug doses to minimize those symptoms, but sometimes they become inevitable, even despite best effort from our medical oncologists, and it is inevitable. It's a part
of the entire treatment, I guess. You even lose your appetite as well. I mean,
yes, people do lose their appetite. Correct.
Yes. How are they supposed to eat without an appetite, right?
Like, we have a dedicated nutritionist at most centers. Means all cancer hospitals should have a dedicated nutritionist who can help the patient, guide them what to eat, how to maintain their calories, their proteins, so that they don't lose muscle mass, which is valuable to our body. They can lose fat, but not muscle. Fat can be gained anytime. Muscle is what you have gained through exercise and endurance. And lack of a protein diet, the body will burn out that muscle. So you need proper dietitian and nutritionist guidance to maintain that.
Even I was even wanting to ask you about how a nutritionist has a role to play. So please continue. Yeah.
Important role. They have a very important role. The thing is, if you imagine cancers of the gastrointestinal tract starts from your mouth and goes to your anal canal, from which we excrete out our feces. So if it is in the upper part, your food pipe, your stomach, your digesting bowel, the patient cannot process their meal properly. Like I gave you an example of passing a feeding tube through the food pipe so that the food reaches the stomach. But what food can be given? The nutritionist has to decide depending, and let me be very clear. Cancer is one thing. Patient might have diabetes, patient might have hypertension, patient might have renal disease, compounding it. It is never a one thing scenario. Means some cancer is mostly imagine someone in their 70s, known diabetic, known high blood pressure, known kidney problems, cancer, unable to eat. You cannot give them everything. So they are so conscious. The patient has to be given sometimes a salt restricted diet. Sometimes when they're very lean, the calorie intake itself is not meeting the basal requirement of the body. High calorie diet, even if it is more starchy than proteinaceous, if the patient has maintained mass, is not very lean, then a high protein, low calorie diet to sustain the muscle mass. So it is very individualized and personalized according to the idiosyncrasies of the comorbidities and the known cancer.
Correct.
So they have a very huge role, very, very huge undermined role in maintaining the proper nutrition of a patient.